Yes. Okay. So all committee members are here with the exception of Councilor Di Lorenzo. I know he's trying to log in to the meeting. So we will go right into the monthly report. And the first on the list, let me just back up for a second. I just want to give everyone a heads up. After the zoning blight enforcement report and the public works facility report, we're going to go out of order and push the report from the health district by the director, and then we'll go back into order with the agenda. So Jose, you're up. Monthly zoning and blight enforcement report.
Hey, good evening. Well, as you can tell from the report that I sent with my along with the agenda, our department's been a little bit of turmoil this month. We had to quarantine a good number of people for 14 days because one of our staff members tested positive. I was the lucky one. I was on vacation for a week, so I avoided the contact. So I had to hold down the fort for a while by myself, which was another experience. But in any case, you can tell by Mike's report, we're also losing 4 people. We've lost 1 assistant building official. Mike has announced his retirement after 28 years with the town. Helen Durfee, our administrative person, is also going to retire as of December 31st. So that's going to take a big bite out of our efficiency. And if that's not enough, last week, Karen Isherwood, our deputy town engineer, said she's taking a new position with the town of Suffield. So, where you can see from Mike's report that he's basically concentrating on tying things up. I'm going to be scheduling, obviously, some serious time with Mike to make sure we have everything that he's working on in detail. So I or whoever we can get, I think Mike will stay on. Perhaps he's volunteered some part-time hours. We don't overwork him to help to stay on past his retirement date. So that'll be good. I think we'll take advantage of that. The one thing that we have been spending some time on and I think we discussed it last time, was 7 Victor Street or Victor Ave. I forgot what, but in any case, right after our last meeting, we had a meeting with the town attorney, myself. I think Phil was in on it, and the building official and Mike, to discuss, what our possibilities were going to be on remedying that situation. I think we spoke with Mark, suggested that he give, I guess he knew Mr. Homelson, one last phone call to try to move him to act on it. That very afternoon, Mr. Homelson did meet with Mike and Kimberly, and said he was agreeable to putting up the fence by himself, and he would get a couple of estimates. Kimberly worked on the numbers in terms of what kind of perimeter we're going to need to secure the site, and I believe on the 12th she's discussed it with him, and gave him the numbers. I think she spoke with him again last week. Mike was out there Thursday inspecting, and he hasn't seen any movement so far. So today we did have some conversations back and forth with the town attorney, and I think if he hasn't done anything by the end of the week, I think we're going to go ahead and order the fence, put it up, and lien the property. So that's where we stand with 7 Victor. Mr. Homelson did speak with Kimberly again today, and he said he was diligently he said he was getting some quotes from American Eagle and National Fencing. So he's talking about it, but it's been a long history of saying things and not doing anything. So we're not too optimistic that he'll do anything this week, but we're giving them just one last chance, and then we're going to act on it. If you have any.
So Jose, to that point, you said we've given him a lot of opportunities to take some actions, and he hasn't, right?
Well, we've cited him a bunch of times, and he was in, as you know, he was in foreclosure for a while, or bankruptcy. I forgot which one, but there were some things that prevented us from taking legal action. I think they're all out of bankruptcy, or he was out of foreclosure now. So I think he sold some of his other properties. So he certainly has the means to do it. And I think this is the last chance he has to do it before we act on it. So this is it. This week, if nothing happens this week, we're going to go ahead.
So that's the time frame this week, and if this week he doesn't do anything, what is the course of action? Are we
is to hire, go through Mark and hire a fence company, get our own estimates, and have a fence company secure the perimeter of the property. So nobody, so people can't get in and secure their safety. As you know, that building, if you've seen the photographs, that building's could collapse anytime.
Is there another option that we have to demolish the building? Is that within our?
That would be, I think we discussed that option, and that was a very costly option. I mean, with remediation and all that, and we really couldn't find the where we're going to get the funding for doing that. It's probably going to cost more than the property would be worth at resale. So we're trying to at least do the least costly that would at least keep people safe from going on there. And I think Nancy was on that conversation we had at staff level. So I think that was the action we thought next action we were going to try to do is to secure the perimeter with a fence, at least keep people from going near the building.
Okay. All right. See, the deputy mayor has his hands up, so I'll go to him. And
yes, thank you, Mr. Chair. Yeah, I just want to make sure that we're free of liabilities in this situation. That house, the front wall is bowed out such a way a windstorm is going to carry it maybe over the fence. I don't know where this fence is going, but I'm wondering if it's sufficient to protect pedestrians on the sidewalk or whatever. I leave it up to you. I mean, as a council person, I'm very concerned about the liability and why we can't take this house down or have them caused to be taken down. It's probably the most dangerous looking property I've ever seen. We've had burnouts, we've had houses like the one on Park Avenue remain for so long, but it wasn't about to cause damage to somebody perhaps walking in the street. Also note that there are vehicles parked very close to this building. Now, I guess you have to move them. I don't know if the fence is going to go all the way around the building or not, but I just want to be assured, and I think the council wants to be assured that we're not subject to any kind of liability for action or inaction by prescribing a fence for this condition.
Well, I think Kimberly, Kimberly Rogers, our building official, took into account, where that building might collapse when she calculated the perimeter that we need to put up. So I think I think she's confident that her calculations and her positioning would at least secure the site.
I mean, even if we had the Public Works backhoe go out there and just knock it onto itself, it would be less of a danger.
Yeah, but again, there may be asbestos, and we don't know. There may be we can't just demolish a building. You have to worry about any kind of lead paint, the type of environmental and health regulations we have to follow before we demolish a building would probably make it very costly to the point where we're leaning the property would not get our money back.
are you good? Deputy Mayor, are you good?
Yes, thanks. I asked the questions I got what I got, so there's not much more I can do here.
Councilor DiLorenzo.
Okay, thank you, Mr. Chair. Appreciate it. Jose, and I'm sorry if I missed this. I came in just a minute or two late. What is the owner? I mean, what are we asking the owner to do, and why isn't the owner taking the action? And I'm sorry if I missed that. Man,
we would eventually, we obviously would want him to knock the building down,
right,
and bear the cost. Right now, we're asking him to secure it, and he's agreed to to get quotes and put up the fence himself, and pretty much told him if he doesn't, we're going to do it.
Okay, so we gave him a deadline to do that. I
believe Kimberly talked with him today and said, we're the last communication from Kimberly was it's time to take action. So I assume she told him that, and that if he doesn't get it done by the end of the week, he knows we're going to go in and get it done and put a lien on the property.
Right. So anything we would spend, we'll put a lien against the property.
Yes. Anything we did, obviously working through Mark to make sure we make everything legal and we have the authority to enter his property and all that kind of good stuff. I mean, there's some degree of due process we have to follow, but I don't think we'd have a problem getting a judge or someone to say we have to secure the property in the interest of public health.
Yeah. Thank you. Thank you, Mr. Chair.
Yeah. Is there any other questions from any committee members for Jose?
No, it just,
All right,
just
thank you,
be
Jose.
patient with us in the coming month because we're going to be under, especially after December 31st.
Yeah, I'm
We're
gonna
gonna be
hold
very
off
short.
on questions in regards to that, but I'll hold off until the town manager gives his report, and I have some questions pertaining to the turnover in the department.
Okay, I have to briefly leave at 7 for another meeting, but I could come back at, at about 7:20 if you're still on.
Yeah, no, that's fine. Thank you.
Okay, thank you.
Okay, so next item is Public Works Facility Monthly Report. Nancy Haynes.
Good evening, counselors. There's really not much more to report from Public Works project that was reported last month. I will tell you that the one large remaining piece, which is the removal of the underground storage tanks, fuel storage tanks, has been put on hold until spring. Part of that was generated by the weather. For background, for those of you that may not have understood or understood clearly, when they started to excavate from where the underground storage tanks were, they started a little bit further away than where the existing tanks are. And as they began excavating, they discovered old tanks that were apparently capped and filled back in the 80s. But they reported it to DEEP, and once you reported it to DEEP, a bunch of other things came into play, and we had to find the documents to indicate that they had been abandoned in place, and that DEEP had the records so that we didn't have to remove those tanks. Same time, they thought they smelled some contaminated soil, and we put a pause on doing anything more because the contract only has an allowance to remove contaminated soil at $10,000. Since that was kind of far away, not far away, but a little bit further away than the existing tanks, and knowing that we don't have much money, as a matter of fact, there's about $16,000 left in the contingency, we put a pause on it while we sought our options. Unfortunately, the cement plants are closing pretty soon, and Public Works had a deadline of December 1st to have those tanks removed because of their winter operations. It would impede the town's ability to access and restock the salt storage shed if we proceeded, and there just wasn't going to be enough time to even begin any further excavating and removal of the existing tanks, the ones that were not abandoned, but the ones that we knew about. So that's kind of been put on hold until the spring. But in the meantime, we do expect to finish up in the facilities workroom, and I think it's a small engine room. So those parts of the project should be completed, and we'll revisit the other part, including possibly identifying, if we can find it, additional funds for the removal of the storage tanks in the spring.
Nancy, what was the number you said you have left in the contingency?
A little under 16,000.
I thought it was 3,300 or so from back in November.
It was actually higher, we thought, because that included the construction manager's contingency, but we've been informed that the construction manager's contingency had already been spent, so we didn't have that information. And I think maybe the 3,300 number that you may have been given in a couple of months ago included change events that had not yet been approved that may be pending. And right now, obviously, with the financial impact and low contingency, there's really not any approval of anything other than what's absolutely necessary. So there's approximately, I want to say $24,000 in but other change events that have not been approved, but have been priced out. Obviously, we can't afford all 24,000 of them, but so we're putting a hold on whatever we can at this point.
Okay, so that's good to know, because like I said, last month we received that
Yes.
number 3,300. So if it's 16, then that's great. So are there any questions from committee members to Nancy in regards to this project? Councilor Di Lorenzo?
Thank you, Mr. Chair. Hey, Nancy. Hi.
Good evening.
Good evening. Just real quick, I guess I'm just a little worried about, the dirt that we found. I mean, is there going to be some research done to determine, what it is or what the smell is? Or is it, if it's contaminated, what type of process is it to, get it out of there?
The smell was an oil smell. So it was assumed that it was contaminated soils. Like we said, there is $10,000 built into the contract for removal of any soils. The concern obviously was if the soils, if the volume of contaminated soil exceeds $10,000 and we were in the process, what would we do? Now, for $9,000, we can do some borings and testing to try to determine how much that is. But if we do that, and we still, it's kind of like, and we confirm that the soils are more extensive than what initially was discovered, then we're out that $9,000 plus whatever it's going to cost to remove and remediate them.
So will the construction manager put together some kind of a plan or?
The construction manager's plan is for the town to find additional money.
Oh.
Phil has a question.
Yeah.
Yeah, I don't have really a question. It's more of a statement. We have two sets of tanks here so that people understand. We've got old tanks, then we have old tanks. And the old tanks were the ones that were discovered when they went to remove the old tanks. So we may be on the hook for removing two sets of tanks here rather than just the ones that were originally included in the contract. And so there may be a need for a capital budget item depending upon the issue going forward, which we can take up during this budget process this winter and spring. But we're in essence cleaning up a project that was cleaned up supposedly back in the 80s. And I can remember being in Avon at the time, and that was the approved method of dealing with these tanks at that time, was to fill them and leave them in place, not to disturb them and take them out. So if rules have changed, we're dealing with a problem that's 40 years old probably, or 35 years old. And it was, to me, it's beyond the scope of really the project to remove two sets of tanks. I think one set of tanks, the most recent ones that were in service, are the ones to be removed. And the old tanks, we're going to have to take a look at that as we move forward. So that's just some background of looking at this problem. Thank you.
All right, thank you, Phil. Any more questions for Nancy? Anyone? Thank you very much, Nancy.
Thank you.
So we're going to go next to Amy Krause, the Director of the Health District. We're going to go a little out of order. That's under new business, but I want to give Amy an opportunity to go ahead and I know she have other things to attend to. So Amy, you're up. Before you go, I just wanted to say the reason why we have Amy today here at the meeting is to give the committee members an opportunity to get an update on what's going on within the town of Bloomfield. Obviously, we've heard that across the country, numbers are going up. There's some concerns, and I think it's a great opportunity to hear some local numbers and what are we doing to help mitigate those spreading of COVID-19. So Amy, you're up. Thank you.
No, thank you. And thank you for inviting me to speak tonight. So currently the town of Bloomfield has 939 new cases of COVID. There are 98 deaths associated with COVID-19. Our numbers currently for both West Hartford and Bloomfield are higher now than they were in spring. So our numbers are not going down, they're continuing to rise. As of today, on a brighter side, our long-term care facilities are doing well. If you remember in the springtime, those facilities were hit hard. If you look at our data, you'll see that in our total number of deaths with COVID in our long-term care data. So as of today, and I double checked before I came, our numbers are still good at our long-term care facilities. Our public health nurses are constantly in contact with our long-term care facilities, making sure that everything is status quo. If there's any issues, we're reporting it to the state licensing division, which we did also in the spring, but we're continuing to monitor that. If you also remember, we do have a grant for $100,000, and that is specifically to look at our assisted living facilities. And we do, even though it's for assisted living and independent, we do still use some of that. It's hard to separate when you're still in a public health pandemic to separate. So again, yes, our numbers are higher now than in the spring. Age group wise, 17.7% are aged 50 to 59 for Bloomfield. Then it drops down to 16.6% are aged 60 to 69. And what is a little bit new is the age group 20 to 30, and then, 20 to 29, and then 30 to 39 are at 11.4%. So right now, those are our three highest age groups. So I wanted to share that with you as well. So just alone today, we have now an epidemiologist. Megan Westcott has been with us since September. And she monitors our data, does a lot of our contact tracing. So she provides me a number of every day of how many cases do we have for today. So currently Bloomfield, just for instance, 20 new cases just popped up today. West Hartford had 42. Average Bloomfield again is about 15 to 20 new cases. The district sees anywhere from 40 to 75 was the highest I think I've seen in a day of new cases. It really depends on the reporting and when we can get the data sent to us. I'm working very closely with Charter Oak for testing, as well as Intercommunity Health out of East Hartford to get those data numbers to me quickly rather than wait for it to go through the state system and then it gets reported to me. The health district for Bloomfield has received, as far as complaints for COVID and in violations of sector guidelines, 6 salons. We've received 6 complaints on 6 salons, 14 restaurants, and we've assisted the town of Bloomfield as with the municipal agent for about 5 cases pertaining to COVID violations. We've been working very closely with the Board of Education. I know they're having another meeting tomorrow night, but they are still in remote until January 19th. Again, we monitor and do the contact tracing very closely with the Board of Education. We finished our flu clinics, jumping a little bit. We finished our flu clinics. We still have flu vaccine, high dose available for ages 65 and older. We roughly did close to 1,800 flu shots this year. We vaccinated the Board of Ed, town employees, Bloomfield Senior Center. We also held a family public clinic, our PD and our fire department. I want to talk just briefly about vaccine. I know that's a question for many, is when is it coming? So Connecticut is looking at receiving the Pfizer vaccine for COVID, as well as Moderna. The Pfizer vaccine is looking to come into the state December 10th, and Moderna is looking to come in on December 17th. The health district is currently considered to be a licensed outpatient clinic, and we are anticipating receiving doses for that. We've worked very hard to meet that criteria in order to receive doses, so we will be vaccinating. My goal is to continue to vaccinate for COVID-19. However, it depends on where I'm being told I can vaccinate and who I can at the local level. According to the governor, when vaccine comes into the state, and again, this can change, but as of right now, the anticipated phases of vaccine for the state of Connecticut, as soon as the vaccine is received, that healthcare workers, long-term care facility residents, and medical first responders will be able to vaccinate. It's my understanding that there's an executive order that should be coming out tonight about looking to see additional people that will be able to vaccinate. For instance, paramedics. So I'm hoping to have paramedics on hand to help assist me with vaccine and to be able to vaccinate. For January and May, vaccine is looking to, we are looking to vaccinate critical workforce, other congregate settings, and adults over the age of 65, as well as our high risk individuals. Closer to June and December, we will then receive vaccine for those under the age of 18 and remaining people in the general community. So this is subject to change. That's the latest information that has been provided to me through the Department of Public Health. Just lastly, and then I can answer any questions that people might have. There was some discussion about the latest CDC guidelines. As you know, we work very closely with our contact tracing, and we follow the guidelines from the Center for Disease Control and the Department of Public Health. You're either asked to quarantine for 10 days or 14 days, depending on your exposure and testing. So earlier last week, the CDC had updated their guidelines regarding being able to test possibly on day 7 of quarantine in order to almost test out of quarantine. Right now, the Department of Public Health has not advised us to follow those guidelines. I'm waiting for for DPH to review and to provide additional guidance. So right now, the health district, like many other health departments in Connecticut, are waiting for that guidance document. So right now, everything we are continuing as is and following the older guidelines. So the contact tracing is continuing, and our public health nurses are continuing to do the contact tracing. But I'd be happy to answer any questions that anyone might have.
Yes, thank you very much, Amy. That was a pretty comprehensive report. Well appreciated. So I have a couple of questions before I go to committee members. And if anyone from the public who's listening do have a question, please raise your hand, or you can type your question in the question box and we'll get it to Amy. So Amy, just in regards to contact tracing, if someone went into a clinic within the town of Bloomfield and they're tested positive for COVID-19, what is the time frame from that clinic to get in? What do they do? Send that information to the state, or they also provide information to the local health district? If you could just explain the process to me, please.
So right now, if you go to get tested, the turnaround time, depending on where, first off, depending on where you go to get tested, because not every place sends your sample to Quest, for instance. Some send samples out of state. So it really depends on where you go for testing. Some places are 24 to 48 hours, some are 3 days. So currently right now in Bloomfield, I'm seeing anywhere from 3 days up to 7 days in order to get test results. I'd like that to be better because when we receive test results on day 7, I'm already a week into this. So when we do the contact tracing and we develop partnerships with our urgent care and our testing partners, I ask them to provide me the testing results for West Hartford and Bloomfield residents. I cannot receive test results from other members of towns. Those results go directly to that local health department. This is a communicable disease, so it's automatically reported to the local health department, like all communicable disease are. So when I say that it's reported, the lab has to provide that information to the state of Connecticut. That data then gets entered into what's called CT EDS, and it's a system. So every day when I look at CT EDS, I can see a list of positive cases. It tells me when the sample was done, where it was done. Hopefully there's phone numbers that are associated. Often we find that that information is missing. So we spend time hunting for that, which slows us down. But that's the process that we follow. So if I'm able to kind of bypass the system and get those results right away, I'm able to call the individual and say, listen, you did test positive. You need to stay home and start the contact tracing rather than wait.
Yeah, thank you. And the last question, what measures are we taking locally to help with folks who may think that the vaccine is not safe? Are we planning some sort of campaign locally to have certain individuals do testing to reassure the public that we have confidence in the vaccine by any chance?
Yep, so that's a great question that local health directors have asked the Department of Public Health. We ask that question weekly. We'd like to start the campaign? When are you going to give me this information so I can start advertising for it? Today, I did reach out, by the way, to Yvette at the senior center and say, listen, I want to, as soon as I can get the vaccine, I want to schedule it. I will come to you. We will come to you. We will vaccinate people there. And so she, we're working on that message so she can get it in her newsletter. So once I'm able to start doing that, I will absolutely, whether it be on social media through the town's website. But that is my goal. I have not been given the information yet to do that.
All right, thank you. I'm going to go to the deputy mayor. Has his hands up?
Thank you, Mr. Chair. Amy, thank you for your work. I'm sure you never thought you'd wind up being ahead of a pandemic when you took over this job, but it's just a quick question. I know that once you're vaccinated, it's not a new ball game and the pandemic is gone, but I'm wondering whether or not the health directors have any sense of what percentage of the population has to be vaccinated for us to all to breathe easier and go back to some semblance of normalcy. Is there any literature, any thought about that?
There is, but not much. There's still a lot of unknown. There was an article, I believe, in the Wall Street Journal about a month ago saying that about 60 to 70% of the population in the United States needed to receive the vaccine. I have not seen any studies. This vaccine will be a 2-dose vaccine. So if you receive the Pfizer vaccine, you need to be able to get your second dose, and it needs to be a Pfizer vaccine dose. You can't switch between both the two types of vaccines. So whatever you receive, you need to be able to receive that again in about a month. And the governor kind of outlined that in his PowerPoint presentation, where he showed, the purpose of that. You have the first one, and then you have some time and delayed. Because this is a new vaccine, the health district, even when you receive a flu shot for the first time and you've never received one, our nurses monitor you for at least 15 minutes for any immediate side effects that will happen. There's been some information that talks about the side effects of the vaccine. There's some people in the studies that received no side effects. So yes, there is a lot of unknown about it, but there's a lot of people that are looking to get this vaccine. However, when you get the vaccine, that does not mean that all of a sudden we don't have to wear masks anymore or practice social distancing. It's going to take time. You're not going to know who received it. You're not going to know what dosage they've received. So as quick as this vaccine needs to happen and needs to come, we still need to maintain social distancing and do our due diligence and make sure that we're protecting our families, our coworkers, and each other, because it will be some time before we get back to normal. Of what is normal.
Thank you for that additional information. Thank you. Very good.
Councilor William, you have a question?
I do. Thank you, Mr. Chair. Hi, Amy. Quick question. Who does the contact tracing for the town employees? And can you give us a little insight? Is that between the health district? Is that something outsourced to the town manager's office?
Yep. So the health district does the contact tracing. When and if you had a employee test positive, we are notified, and the questions get posed to us. We ask for names and contact information. If there's a question, we will contact the employee and review any symptoms that they might have had when they got tested. Often we will, when we do call them, if there's a need to call them at that point, we provide information for what their family needs to do. And so that individual should be isolating themselves from their family so their family doesn't get it. When employees travel, that information is also provided, so I can take a look to make sure that the appropriate test has come back, that it's a PCR test and not a rapid test. So yes, I've been doing that for the town. Same thing with Board of Education. If there's any questions, we communicate very well back and forth.
Thank you. And one other question in regards, and I don't know if maybe I missed it. You are still developing a marketing plan, if you will, to get the word out when the vaccines are available and later this month. Will you be able to share that with our town management?
Absolutely. That will be presented to the town manager and our executive group. Absolutely. I just have not been given that information yet through the Department of Public Health.
Okay. And the Department of Public Health would be prioritizing certain groups that would need to be targeted first from a high risk or exposure standpoint. With that, how?
Correct. So through the advisory group that has been put together through the governor's office. So the first group to receive vaccine is healthcare workers, long-term care facility residents, and then medical first responders. Then in approximately January through May, the governor outlined that to be critical workforce. So municipal employees, teachers, that's considered to be your critical workforce, public works, critical workforce. Also other congregate settings, adults over the age of 65, and then high risk. The general population for those under the age of 18 and people remaining over the age of 18 is looking to be June into December of next year.
Okay, great. Thank you. Thank you, Mr. Chair.
Yeah. Amy, there's a question from Councilor Calhoun. She says, how does the airlines and sport teams able to receive 1 to 2 days results and the general population have to wait 5 to 14 days? So basically, it seems like, certain groups are able to get it within 1 or 2 days and the general population has to wait a long time to. What is the reason for that?
I don't have the reason. The only thing I can think of, again, as I mentioned, is it depends on where those samples are being sent, who's doing the processing of those samples. UConn, for instance, Jackson Laboratory has a turnaround time of 24 to 48 hours. It's all about where that sample is being sent. There was recently, I was made aware of today that there's a home test that you can buy. Your insurance pays for it. You do the sample and you get those results in about 3 days. And that's done through mail. And I believe that it gets mailed to a lab in the Carolinas. So again, it all depends on where that sample is being sent. But I can't speak for specifically where those samples are being sent without knowing.
All right, thank you. Is there any other question? Oh, see the mayor just put her hands up. 1 second. Phil, just give me 1 second, please. Mayor.
Thank you, Mr. Chair. Amy, can you please speak about the difference between the PCR and the rapid? Because I do know that some people gets that a little bit confusing. Some people, some of the responses that they're getting or tests that they're taking is rapid tests. So you can talk about a little bit the difference between the rapid and the PCR and what we actually.
Yeah. So there is a difference, obviously, between the PCR and a rapid test. If you are symptomatic and you go for a rapid test too soon, you might have not have developed enough antibodies yet. And so your test might show up negative. When people get tested, we encourage people, especially if you've had an exposure or a contact to someone who's tested positive, we ask people to wait at least 72 hours. And again, that's because your body might have not developed enough antibodies yet for a rapid test to be as sensitive to show and come up as a positive test. A PCR test, the sensitivity of the test is better than the rapid test. So again, that's why we encourage PCR tests. That's why you'll see that for travel requirements. As far as that CDC guidelines being released, where people can test out, right now, the question is, will you be able to, if you test out of a quarantine, can you use a PCR or a RAP test? And right now there's not enough information yet on that. It just says a test. So really that's the difference between the two. A rapid, you're going to get quick results. But again, if you're positive, you want definitive results, you're going to want that PCR test. The rapid is if you're symptomatic and your test comes back negative, you might have gotten a false result, you might have tested too soon.
Thank you, Amy. All right, so any more questions for Amy? Excuse me. Okay. I don't see any. Oh, sorry. The town manager. Phil, you're on mute.
Yeah, I don't really have a question for Amy, but I do have, I do need to let the council know that you've been designated, or at least your names as the town council have been submitted as essential, I won't say employees, but essential personnel for the functioning of the government. So more than likely sometime in that January to, I guess, May, is it, Amy? Time frame, you're going to end up being called to get yourself vaccinated. We can't operate a government without the council. So you're going to be part of that. You're the legislative body of the community. And if we have situations where you need to vote on something or have items come before you, so you've been submitted as essential. I just wanted to let you know that. So
thank you for that information, Phil. Thank you very much. Okay, thank you, Amy. Have a wonderful evening, and thank you for all the great work you're doing.
Thank you, and thank you for having me.
Thank you. Okay, so we're going to go back in order with the agenda. The next item under old business, discussion and possible action concerning a policy on public art display. So we did receive, the town attorney did review the policy, made some tweaks. The one item that we took out that we had within the policy is talking about a 501(c). I don't think that's something that we wanted to go that route. I know that Bob Ferger, I had a discussion with him. That could be an independent organization within the town that could kind of gear towards finding alternative funds outside of the town and bring in for University of Hartford and so on. So that's out of the policy. I'm hoping that everyone had an opportunity to go through it. And if you have any questions tonight, please let me know. Deputy Mayor?
I hope I'm not the only one with questions, but I thought it was a good second shot at this. I'm still confused as to whether or not we're crossing the line into musical and art festivals, because that word's still in here. And I know that that's a province of the committee, Community Services Committee and the Leisure Services. And I don't want to duplicate that, and I don't want to confuse it. So I really wonder, I would like to see us focus more on the public art, which was the original motivation for this and take it one step at a time. If this becomes a super home run, we can fold that into as we go further. But that's one area I would raise question. The other thing is we're talking about setting up the Arts Commission, and there's no indication except that there are people from the community as to what the qualifications might be. If we're asking for people to make judgments about art, we hope that the people have had some experience evaluating art or whatever that means to make those decisions. That's, I think, could help the policy if we were to identify certain characteristics. Not everybody has to be, I mean, like with the design review board, not everybody has to be an architect, planner, or urban designer, but at least there are a number of them on the committee that can speak with the vocabulary needed in order to evaluate. I think that's another, that would tighten this up to add a little bit more information there. Also, let's see what else I have here. So am I the only one here that's going to raise a question?
Let me Deputy Mayor, if you don't mind, I could address your first concern and then the second concern. So in regards to the section where you were saying that we may want to take it slowly in regards to visual art, performance art, I think what's important is to basically streamline. Right now, as you stated, through leisure service, and a lot of that burden is on town staff right now in trying to coordinate a lot of those events. I'm not suggesting at all that we make that transition tomorrow or next week or next month, but this policy would guide that transition. For instance, some of those individuals from the public who is participating within volunteering with members from our staff in trying to run those various activities can be part of this committee. So when you're going out to look to get volunteers to be on this committee, you're looking to get folks with various interests to partake in that. So the policy is to have that framework in place to be able to ignite that fusion and getting all those various pieces together. And I would say in the next year or so, that could transition. But I think it's important to have that framework within the policy, because you're just passing a policy to say, okay, here are the various guidelines.
Well, I think in that regard, Mr. Chair, that if you wanted to get defined over time by the commission, then maybe the initial piece has to be more general, stating the goals and what you're trying to accomplish here, and let it be threshed out in more detail by those people who are going to take ownership of it more directly. I think there's a lot in here that goes beyond policy. It's actually stating operational directives. And I think that's something, if we're going to do that, we need to spend more time doing that.
Could you, which section are you referring to in regards to operational?
Well, I mean, when we're talking about selecting art pieces, I mean, are these to be jury, or is there supposed to be any process for this, or it's just a fancy, just a minute. I'm not, yeah. Please don't take it personally. I'm just asking.
No, it's not personal. I'm trying to get to where you're coming from. That's
from the standpoint of having a public art policy. Is it the first one that comes in has something, or is it the third person, or are we going to ask for several pieces or items to be submitted so that there could be a juried process? That's one way that it works in a public art situation, and that is also one way that gives us more of an ability to see what the commissions to see what the possibilities are that they can receive. So if you put a request for proposals or request for art submissions, they would go through a process of evaluation and be juried by this commission, and the commission can make its recommendation to council in that way.
Yeah, no, I hear what you're saying. And what the vision is with this is that commission will be responsible for doing that. And I would say you could look at any commission that we have in place. We talk about EDC, CEC, same thing. I mean, these are commissions that are making decision recommendations to the council, and that would be the same process here. So I understand what you're saying in regards to making sure that you have folks on this committee that have some sort of background within the arts. But that then changed the dynamics across the board when it comes to volunteerism within the town. You're not looking to make sure that everyone has a resume that can serve on committees. So I think that's something that we have to be careful of. But I'm going to go to the mayor and hear what she has to say on this.
Wait a minute. No, I didn't say it had to be, everybody had to have credentials, but there's certainly, my thought was that there should be people with credentials and not just folks who are coming out to sit and see, picking something over something else and have no ability to evaluate except, well, I like this, I like that. So,
but I think you're insinuating that that's going to be the process, and I don't believe that's the case.
No, I'm saying it is, from this piece of paper, there's no indication it's not going to be the process.
No, but
that's what I'm saying. But opening this up needs a little bit more time.
Yeah, but what you're saying is we have to have in this document to say that the person have to have some sort of background in art. Is that what you're saying?
I think that should be one of the reasons for selecting them. Yes.
Yeah, but I
think everybody. I mean, it could be, certainly there can be residents without that kind of degree. Like I said, I use the design review as an example because there are people who are appointed who didn't have any professional experience, but who had a desire and interest. That's fine, but what depends. You get what you get what you look for here, and if you're just going to throw it open to anybody to come in and sit on this panel, what is it we're going to get?
But I believe we have a process in place that we go through when we appoint anyone in any boards of commission. They submit an interest form and we go through, there's an interview process. So I don't think that it's basically, I don't think this policy has to outline that the person need a background in
Wouldn't
art.
it be preferable if it said at least that several of the members or a certain proportion of the members should have some sort of experience professionally or school-wise?
I may have a different opinion on this one, but I'll open it up for my colleagues on the committee to hear what they have to say. Mayor, you're unmuted. Yep.
Thank you, Mr. Chair. I think going through the policy is a framework. And I think every committee that we have, there are subject matter experts on those committees, as well as regular people who are interested. I'm going to believe that most of our committees have a good mixture. I think of the building committee. I think of the design review committee. It's a mixture of subject matter experts and a mixture of volunteers who are interested in that committee's mission. So I see a policy as a framework and a roadmap. I do believe that one of the hiccups that we had is that we didn't have a policy. So we came up with a situation arise. We came up with, let's do murals, and there wasn't a policy and people couldn't support it because there wasn't a policy in place. Now we're trying to put a policy in place. We can work out the steps and we can make sure that the members of the committee is a strong mix of subject matter experts and those who are passionate. We are very fortunate here in Bloomfield that we do have artists that have their own shop that has done work across the country. So we're not just going to pick up, forgive me, right? We're not just going to pick up Joe Public, but if Joe Public wants to be a part of the committee as well, as long as there's a mix of subject matter experts, I think that would be the expectation. Thank you.
Yeah, thank you. Councilor Lorenzo.
Okay, you can hear me, right?
Yep, I can hear you.
Thank you, Mr. Chair. Appreciate it. I guess, in going back to Deputy Mayor Mann's comments, I was wondering if maybe in the beginning, under the definitions where it talks about the Public Art Commission is made up of members of the community, why couldn't we add a statement there that including, people who have a background in art or whatever you want to call it. It could be a teacher, it could be a school member, it could be, something that says that somebody should have some qualification in, knowing what art is for the town.
All right. Yep.
That would be my comment there. I think my other comment is, one of the things I don't see here is, how do we identify what the town currently has in way of art that is already around the town? Do we consider the drummer boy to be art? I mean, where is our current listing of all the facilities, all of the areas within the town, public spaces that potentially have art already in them? We don't have that really documented anywhere that I know of. So I'm wondering if should this policy also include the beginning of, let's create what we currently have so that we know what exists, and then let's determine where we think we have gaps and want to put some kind of piece of art or whatever it might be. That would be my next comment. The other thing I would comment on is, I guess I'm a little concerned about the funding piece, because in here, it talks about, well, I think we could probably, and maybe I missed it, but maybe there are grants that we could add to here that the Art Commission, or when that's formed, they should seek out grants. But the piece about funding that concerns me is putting money into the capital improvement budget if we don't have anything identified. I don't want to set aside money for something that we don't really have yet. So I think the process would have to be, like you said, they would fill out I don't know if someone comes forward and says, yeah, hey, we want to do something. Well, then if we don't have money currently budgeted, that's going to have to wait until either we find money out of a contingency fund, or we go to the next budget cycle, and then we could appropriate funds in the capital improvement project. I think I would be concerned about putting money there for something that we don't have.
Yeah, that's a good point, Councilor Di Lorenzo. And I don't think the policy is saying that you have to put anything currently in this current budget process. I think this is over a period of time. The council will have to, saying, put your money where your mouth is in order to take the lead on some of these initiatives per se. Mm-hmm. So I don't envision at all that we're investing any money right now into this. I think once the committee is in place and could provide a report to council, a recommendation on funding per se, then we can go that route. But I think right now it's basically just having this policy in place, having the committee be assigned, and then we can talk about, what type of funding that will be recommended from this committee to the full council per se.
Okay, so would the committee, would it then become an official committee under the town, like, the Philly Park Committee? Would it become a committee of committees committee that would go, it's going to be formed through committee on committees?
I think, Mayor, you want to chime in?
Just a couple of things. Stepping back a little bit, we received a donation from Meredith Johnson at the Dollhouse, I think maybe about a year ago. And we still have that piece of art, and we have done nothing with it. We have not decided where to put it. It's not hung up yet. So I think this commission can also help in that respect. Maybe other people will donate art to the town and for the town, whether it's for a period of time, whether it's because family donations or things like that. So that can be helpful there. I think one of the things that we do, if we're taking in art as a whole, some of the celebrations that we do have here in town, I believe the committee could start as a ad hoc committee and see how we roll into that, whether we're going to roll into a committee of committees, or we're going to roll and spin it off into something totally separate by itself. I think this policy is a trial, for lack of a better word, to see. This came up because of an incident, for lack of a better word. The mural created a need for policy. Going forward, how many incidents like that are we going to have? How are we going to use this policy? How often are we going to use this policy? How does this policy fit into what we want Bloomfield to look like? Counselors, we're going to figure that out when we go to our retreat. But right now, if we can start it off as a pilot and then roll it off, or see where we end up with it, if it has to be tweaked, if it has to be defunct, that would be my suggestion with this, because once again, it came up because of a specific situation. And I don't know how many of those situations we will have going forward.
Mayor, I just wanted to chime in for a quick second. I know the question was, are we going to do an ad hoc, or is this going to go through committees on committees to make it a formal committee, as the EDC or CEC? What is the best course of actions to do that? I think if it goes through committees on committees, then you have the process of someone submitting an interest form, and the committee going through and making a recommendation to the full council.
However the committee decides the best course of action, that's okay. How we should roll it.
Okay. Yeah. Councilor Lorenzo, any more questions on that?
Not at the moment. Those were the things that I saw. Like, now there's a perfect example. The mayor pointed out that we have a piece of artwork that was loaned to us or donated to us by a doll's house. How do we know that? I mean, where is our list of what public art has been donated and it's available to us? And I mean, that was one of the big things when we were going through with the building committee for the 330 Park. Everybody was looking to see what could go in that building. Well, I think this is a perfect example. This group could identify and go out to the community and look for people who can donate or loan us works of art that could be utilized in the town, where they will be on display for people's enjoyment.
Yeah, and that will be part of the charge of the committee, is to first look at the inventory before they move to go try to solicit funds from outside, and just like a Philly Park or so on. So I do agree with you. Mm-hmm. I think we have to, once we get this policy in place and we have the committee, then they can start doing the work and trying to collaborate in all the pieces together. So are you good, Councilor Di Lorenzo?
Oh yeah, I'm good for now. Thank you.
Deputy Mayor?
Yes, thank you, Mr. Chair. Still have a few questions, and I just want to make reference to the mayor's comment about the Black Lives Matter mural. The issue that arose then is that nobody was in position to review what was going to be placed on town property, which I thought was inappropriate for us to approve something that we didn't know what was going to be. Now, I realize that there were certain council people, the mayor may be included, I don't know, who knew, or at least had more information about what this was going to be, but the rest of us had not. So that was the reason why the word policy came out. And just to say that this is a policy now because of that is a little disingenuous. I think if we're going to go forward with an arts policy, it has to be something that is understandable and that is workable. And I think there's still 3 more questions I'd like to raise. For example, there's a statement on the last page that says, town public events should involve a public art component as appropriate to the event. Now it says a should. So does that mean if there's no public art component, we're not going to have a town public event? I mean, it's words, I understand that, but it's what's in the policy. It talks about private businesses having, comments, I find it, but we should have really very little to say about a private individual who wants to erect a piece of art. It's his own property and he can put up what he wants. Unless, and I don't know that their town does have the ability to control that, but it's implied in here that we do. Is that what we want to do? I'm not sure. So there are things in here that are questionable. We have presently art exhibits at Town Hall. Seniors put up something 2 or 3 times a year at Town Hall. Is that something that's going to be affected by these guidelines? I don't know. It implies that it should be because it's public art. So, you can't have it both ways. I really would like to see a public art policy that at least lays out who's going to look at it, what should be looked at, and just leave it general to be filled out later. Now, I think Councilman DiLorenzo's comments about the inclusion at some point of whoever's going to be on this board to at least have some indication that they have art or professional experience in the area for a certain number of the members or some of the members is a good substitute in here for otherwise language that says be an issue. Where is it? Public art commission be made up of members of the community. Well, we know that's going to be the case because you got to be selected from the community. Unless we want to go beyond that to include somebody from the University of Hartford, who's mentioned in here someplace. Maybe a person there should be ex officio or something like that. So I'm not objecting to having an art policy. I just want to have something that's that's workable that we can implement and that everybody understands what it is. And maybe maybe if we submit comments and we all take a look together or put together a committee, a smaller committee, subcommittee to work on the language, or maybe that would help.
Deputy Mayor, the town attorney did review the policy like any other policy. He did review it. He did sign off on it. I think this policy is ready to be recommended to the council for Monday. Like any policy, there's opportunities to make improvements as you go forward. But I don't see a need. I haven't seen any input in the last month or two on some of the things that you're addressing. I do believe that it's important. I do believe that it's important to not have a process in the town where, and too often we do have that, where things are fragmented. For instance, the library will do something different. Like you stated, leisure service will do something different. We need to have a more central way of doing things. And I think this policy will get us there. And I think once the members of this committee get in place, they will be able to make recommendations to the full council to make decisions on this. I would love to hear from the town manager. He had an opportunity to look at this policy to hear what he has to say. I think you're unmuted, Phil.
Yeah, there we go. Yeah, I looked over the policy. I think having a public art policy is a good thing. I think David does bring up some issues in terms of mandatory interpretations of some of the language. I'm always looking at things administratively. If we create a standing committee, you got to have staff support, you got to have agendas, you got to have minutes, you got to record all these at the town clerks. We have to have appointments and so forth. But I think that the issue has popped up several times. I wasn't around for the murals, but I was around maybe roughly the time of the dedication of the Human Services Center. And there were a number of questions brought up at that time as to people wanting to have things placed on walls, and we didn't have time limits. We didn't have a policy in place to govern that. So I think we do need to have a policy. Maybe David, I don't know, depending upon what the committee tonight decides that they want to do, is that maybe we need to sit down again and kind of go over some of that. I think Mark Needleman, the town attorney, when he looks at these, is basically looking at what's the council's desire. If this is the council's desire, it's fine. He doesn't make comments at me, and I'm sure that he will speak up if I'm treading on his turf here, but he generally will not get into, I mean, he may raise them for you to consider, but he doesn't opine really on the administrative impacts of a lot of things in terms of what the secondary or tertiary corollary issues are with a policy. Every policy is going to engender some discussion. It's going to engender potential controversy if the wrong issues develop out of it, the controversial issues that are always there. It can create drama, there's no doubt about that, but that's why we're here, is to try to sort these things out. So I have no problems with a policy. Maybe it needs some wordsmithing, but I think that also can be done down the road after we've had it in place a while and seen how the group of people that'll be working with it. I just get concerned over some of the administrative overhead that we're creating with policies. So if I've got the staff to deal with it, I'm fine. And I've got my oar in the water by saying these things. So that's basically my comments at this time, Mr. Chairman.
Okay, thank you, Phil. So if there isn't any other discussion, I would like to entertain a motion to move this item. One second.
Councilor DiLorenzo has his hand up.
Yeah, Councilor.
Yep. Okay, so before I'm going to make a motion, but I just have a question before I do that. So can this policy be approved by the council in a draft form, or does it have to be approved as a final version? I mean, can there be a caveat that the policy is considered draft until a committee is able to work through it and come back with another version? Or does this policy as it is, with maybe, I don't know if there's going to be some edits after tonight based on comments, but when we put it forward to the full council, is it being submitted in its current, is it being approved in its current form or as a draft?
Yeah, I think it's in its current form. Like any policy, Councilor DiLorenzo, I think down the road, like the town manager say, if we need to make amendments to it, we can. Once that committee is put in place, and they may come with additional recommendations to amend to that policy. But it is a policy being recommended to the council.
Okay, so based on tonight's comments, though, do you see, based on the comments tonight, if I make a motion, will it include any further edits based on tonight's discussion?
Well, I know a couple of the comments that the deputy mayor had in regards to making the policy more constrained and not include performance art. And I disagree on that. I believe we have to have a more comprehensive policy in place. And as we move forward, we can phase it in per se. And I believe that's the way to go, instead of trying to just deal with visual art and then later down the road. I think a policy is just a framework to be able to implement those different phases.
Okay, but can we clarify that the committee should consist of someone who has experience in the art world?
I believe that we have to be careful with that, because I haven't seen a single committee that we've put in place that we put whatever procedure in place saying this person has to have a certain background. I truly do believe once this get out, you're going to have folks within the community. Everyone has their interest in different areas. Folks want to be on EDC, they want to be on, I believe that we will be able to get folks within the community. I know the mayor have individuals who are artists within the town that wants to get involved.
We had some very good ones who did the mural.
Yes.
Okay, so anything though that anyone wants to do comes back to the council for approval.
Absolutely.
Okay,
Absolutely.
so, and as far as the funding piece goes, do we need any clarifications on the funding and any clarifications?
No, I don't think so. I believe when we go through the budget process, if we went through the process this time around and we approve let's say $10,000, I think that's fine, but I don't see that happening this budget process. So
Right.
I think that's a decision that the council will have to make. This policy doesn't drive that.
Okay, well then I'll make the motion that we submit the draft policy to the full council for review and approval with the caveat that any final edits are made to the document based on comments received tonight. So maybe you could take another run through it and make any tweaks.
Do I have a second?
So before I do that, I just wanted to say that revisions can be made at any point in time. And I think this is a framework. And I think once the committee is in place and they look at the document, they might also want to make revisions to the document. So I think being open to that, because once again, if you get subject matter experts, they may be able to see something that we haven't seen or something that we've missed. So with that caveat, I will go ahead and second the motion.
Okay, so we have a motion, we have a second, open for discussion. Deputy Mayor?
Yes, I find it difficult to accept this line of thinking. We are supposedly the policy people of the town. If we can't come up with something that we feel is going to just be passed so that someone else can make something out of it, I don't think that's good policy. I think we have to, and I think it heads back to some of the things we're talking about. If you want, I have no question that there are plenty of artists in this town that could meet the qualification. But if we don't say there shall be people of some artist experience on this committee, if we can't come to that agreement now, then I really lay suspect to all the rest of the information. If we can't say we want this to be specifically for this, for public art, you want to do for performance art and all that other stuff, that's fine. But now you're impinging on other activities within the town, and we haven't even dealt with that yet. So are we duplicating? Are we confusing? We are. And I think we can make this simpler if we spend the time to work on it. Now, there were comments made at the last meeting a month ago. Has anybody been approached to follow up or have any other input? No, this is I think whoever's putting this together.
Deputy Mayor, with all due respect, the work has been put into this. Every individual that spoke at the last meeting was reached out to.
Nobody called me, and I had comments about festivals are still in there.
No, but once again, I think we're confusing two things. That's an opinion that you have, and you have a right to have it. It doesn't mean that because you said that this needs to be out because we don't need to have performance art, we should take it out. That's a committee decision.
Well, we discussed that amongst a number of things here, Mr. Chair. It's not just that one thing. I just think we need to spend what's the purpose to rush judgment on this?
We're not rushing here.
Well, that's why I think we should spend the time to get it right.
We're not,
if we can.
Okay, can I
call? My opinion.
Yeah.
Thank you for giving me the right to my opinion. That's fine.
Thank you. Could I call the question? All in favor signify by saying aye.
Aye.
Any abstention? Opposed?
I'll be opposed.
Yep. Motion carries. Thank you. So the next item on the list, discussion regarding the equity assessment policy. We have Randy Renee on the call here tonight. She's a consultant that worked with the town of Bloomfield, worked with Alliance for Bloomfield's Children, worked with the council and the mayor. And Councilor Wong is also part of the meeting here tonight that brought the equity policy forward to the committee to do some work on. And I think it's important for us to figure out exactly what an equity policy looks like for the town of Bloomfield. And I think that's important because we can, one second, let me mute the deputy mayor, thank you. And to find something that works for the town of Bloomfield. So I think it's important to have a foundation. And I just wanted to bring Randy in tonight to get a sense of the work that she has done and what we could do here in the town of Bloomfield in regards to an equity policy and how we can start that work. So Randy, I'll give you an opportunity to introduce yourself.
I'm not visual, but can you all hear me?
We could barely hear you.
Okay. Let's see. Let me try.
Indy, is there a way you could make Randy visual?
Hi, can you all hear me?
Yes.
Yeah. Okay. So I've been see a few familiar faces. Thank you for having me. I think everybody, almost everyone here is someone I've met before, I've worked with before. So Rickford invited me here this evening to talk about the possible journey that Bloomfield might be taking in developing an equity assessment policy. And I told Rickford that I would share sort of what other communities have done in Connecticut and across the United States when they have determined that an equity policy is desired or needed for their community. Normally, the process begins by having some initial training and conversations around many of the underlying concepts that related to equity. And so that looks at many categories in which people experience disparities. So that could be race, that could be gender, that could be class, it can be ability, it can be gender identity, and so on and so forth. So the first start on this journey is usually, a community coming together to explore the fundamental understanding of those concepts related to equity or inequities in their community. And then usually once everyone has a shared understanding and shared language around what you're actually talking about when you mean equity, you begin to determine what are the equity needs in your specific community. So as you can understand and might imagine, that each equity policy is specific to the community in which you live. You can't port over something in one town into another town because the experiences and the people in that town is very different. And sometimes that can be the next town over. Sometimes it can be a town 20 miles away. So often there is a deep dive into what are the issues of inequity in your specific community? How are people living, breathing, and experiencing intersections of living in the community due to their social identities they hold? Some visible, some not so visible. And so those experiences can be different from person to person. They can be layered on if they have various layers of their identity. So you really want to get an understanding of the people who you represent. How are they experiencing the community? And then from there, you start to take that data and begin to construct what your strategy to address equity in your community is. Now, there are various ways in which you can infuse equity into your work. That can be internal within the group, and that can be external within the community through the implementation of particular policies or strategies or opportunities. And when you look at an equity, this says an equity assessment policy, you can have a equity strategy and an assessment policy be a part of that larger equity strategy. Given the work that I have done up until this point with many of you on the call, and that has come through the Alliance for Bloomfield's Children, we had some cafe conversations to explore things like unconscious bias and microaggressions. We've also explored sort of what culture looks like when different groups of people come together under a shared agenda, how the ways that we show up as individuals and work in relationship to others. And then we haven't had the opportunity to share with all of you, but the Alliance for Bloomfield's Children started this work with a power analysis. So when the Alliance for Bloomfield's Children decided to go on this journey towards equity in Bloomfield, they did, a multi-day anti-racism training, right? And then they brought me in as a consultant, and I've been there for about 3 years. And the first thing we did was a power analysis. Many communities start with a power analysis to understand who's making decisions for whom, and what's the power that people in a community feel that they hold, and what's the power that where do the decisions that impact their lives, who's making them, and how does that happen? And so we went through a full day power analysis as a group just to see what are the major issues in Bloomfield that people feel of or concern that they feel directly within their lives, and who's making those decisions. And in those areas, it really was around the town council, the Board of Education, that ABC decided to direct most of its focus towards. And that's how we did the cafes with you all, to sort of raise the awareness around what are some of the underlying concepts that get in the way of a community achieving equity. And, you know, as you all know, race is just one of them, but there's also class, ability, gender identity, sexuality, all of those other things. And then you start intersecting them and their people's experiences change significantly. So we talked a little bit about those things. So I think you've done, as a group, you've done some of the pre-work to this. But then there's the shared language piece, there's the shared understanding. What are we actually talking about? A community assessment, like the people when we did this work in Middletown, we had all of the senior officials got, you know, 2-day anti-racism training, right? That's where they started to understand and have some shared language. But then there were focus groups in those communities to understand how are people experiencing their town. And from that, they're developing an equity action plan. So there's steps along the journey so that when you do this work, it's intentional and it's customized to meet the needs of your community. And part of that is listening to the people in your community to find out how are they experiencing Bloomfield? What do they feel is helping them, not helping them, and what can you do more of to help them? And when you apply an equity lens to that, how we define that in the social justice world is looking at those who have been traditionally marginalized due to particular policies, who's been left behind through intentional policies, starting with them. And hopefully the work that you do reverberates up to other groups who feel those inequities less. So it's not to suggest that because a person is white, middle class, or white, lower middle class, isn't feeling inequities. The notion is they have not been traditionally marginalized as a group. So if you start with the groups that have been traditionally marginalized against, it has no way but to trickle up to the other groups as well. So whatever you do for the least of people will benefit all people is the notion that we use within the social justice world around really looking at intentional equity. And when we look at intentional equity in the social justice world, what we mean by that is that they're real tangible outcomes that people can feel in their lives when you say you're doing equity, when you're applying an equity lens. So obviously training isn't enough. Obviously having conversations isn't enough. And obviously just having an equity statement isn't enough. There needs to be some sort of tangible things that your community can see that says we are really placing equity as a high priority in all that we do in the town of Bloomfield. So, you know, there's multiple steps on that journey. We have people like myself and others who can work with you on various points of the journey. From what I understand, you have individuals who've been coming in and have been enacting certain pieces of it. And so I think a good place for you all to think about at this point is the broader equity strategy. What are the goals that you're actually going to measure and look back at each year to say that we have an equity strategy in place, but this is how we know we're moving along on that journey so that you can actually refine it each year to make sure that you're doing purposeful, intentional things to get what you want to see as a result of the work that you're doing. So I'll pause there and take any questions people may have or comments.
Thank you, Randy. I want to give Councilor Wong an opportunity to kind of give her 2 cents on this and the actual policy that she provided to the council as a framework. Councilor Wong?
Sure. Thank you, Mr. Chair. Randy, it's so good to hear from you again. Thank you for being here today. Anytime you have something to say about these topics in social justice and equity, I am all ears, and I definitely appreciate your expertise in this subject. And I do want to say that, you know, what Randy described in regards to kind of the mandate or the goal to close those inequity gaps year after year or time after time, once we do establish a scope and identify what data points we are going to be leveraging for this particular program, that is exactly what the policy is calling for. It's calling to, and if you remember the motion that we made on the floor, the policy is to go to admin education, as it is today, to identify what the resources look like. It's going to go to finance to identify what the dollar amount is going to be assigned to those resources. And we're going to continue the discussion in community services or in jointly with admin education to identify what equity means for Bloomfield. So to Randy's point, we are in very early stages of what this policy means. It's very exciting for, I think, most of us here, or if not all of us. And I think I learned something new from Randy's perspective as far as step one being, she mentioned step one being understanding kind of the shared language, shared strategy, shared understanding of what this means. And I think that that aligns with some of what we had discussed in regards of identifying the scope and identifying and defining what equity means for Bloomfield, and continuing that social equity discussion as Phil had directed us or advised us to do some time ago. I do want to make sure that while, and maybe Randy, this is a question for you to answer, I guess. I know you've worked with multiple towns, you're saying, as far as implementing a policy or program, but this policy or the concept thereof is, in addition to having the training as a mandate, however frequent we can have it or afford it within the town, that one of the priorities in the policy is also kind of analyzing where we are today with our policies and procedures and pulling out oppressive language in the content that we have internally and how we operate in departments within town. I think that's a very important part as well. It does also go in tandem with, again, identifying the scope of what this policy is going to encompass: race, income, gender, class, things of that nature. And I think there's a third part, which I do not have it in front of me, but essentially there is a mandate, again, to close gaps and inequities that we've identified from the start, which we're in that phase one now, to close those gaps year after year or as soon as we can from a town operation standpoint. So if you could elaborate, if you have expertise on kind of shining a light on what that means as far as your journey to, if you have been, if this is a part of your work, analyzing current policies and procedures in other towns and kind of pinpointing the oppressive language or language that kind of does the adverse effect of closing gaps in the inequities that we've described, as well as some of your other experiences with kind of implementing a robust program for data and equity. Thank you, Mr. Chair.
Welcome.
So I could provide my full bio, but we don't have enough time for that. But I'm currently on contract with several cities, including Bloomfield, with the Alliance of Bloomfield Children in New London. And what I can say is there's a methodology to it. There's not a one size fits all. So with the absence of what I have right now from the various conversations is really just like a mixed mash of things that are happening towards something. So in my experience, how I do the work is usually we take a step back to say, what is it that you're trying to achieve, right? So it's usually the RBA framework to say, well, what is equity in Bloomfield? And how do you actually identify that? And then but we do believe in this work being sustainable. And so what a facilitator and a consultant does is really guide you in developing the strategy and outlining the goals of that strategy and helping you prepare tools to actually assess and analyze if you're actually on track to meet the goals that you outline. However, the work needs to be sustainable in your community. So it really is on this body or the town council to decide who's going to carry the work forward. So in Middletown, they have a committee, a racial justice action committee, who's doing the work. As a consultant, I'm only offering expertise and guidance and a framework to help them develop that, but they're the ones actually implementing the strategy. So it would be my expectation that you all would actually implement it or develop or gather the resources to do so. But there's any number of frameworks that I know of, have been a part of, that you can look at for guidance. And so I think one of the strongest ones that I've been a part of is in Middletown. And can't say enough about them, but one of the core parts of that project was really getting the people who are most impacted involved in this conversation.
Absolutely.
And it's one of the many things that communities fail to do. They develop something, they're doing all this stuff, and then after they check back with people who it's for. So in order to work with me, that is a non-negotiable, that you have some part of the process that is involving the people who are most impacted early on and upfront. So that's driving that. So it's hard to say, here's a set of things when we haven't talked to people in your community about what it is that they need. That would be a really early step for me to help you identify the rest of the pieces going forward. For example, if people identify, economics as one of the areas that they feel the most weight of inequity in, you have to analyze, well, what's the jobs that are available? What's the prospects for someone who graduates from high school, goes on to college and lives in Bloomfield? What type of life can they have? And if they want a particular life, what are the barriers that happen for that person? And then you're going to say, well, one of the things that we're going to look at contracts or particular projects that happen in the city. We're going to make sure we allocate a certain number of those to minority-owned businesses. Then there's a certain tool that you track and measure that, right? So that's the logic behind it. I have done it, continue to do it, but it looks different in every community. Some communities, they really, really stop at the training stuff. They're not ready for the other pieces. So they're still in that phase where they're learning and understanding. Whereas the work that I'm doing in London with the Community Foundation of Eastern Connecticut, we started off with the board of the foundation. Now we did some stuff with the staff. Now we're doing something with nonprofits. We're doing something with school districts, and we're doing something with grant making. All of that evolved over time based on the needs of Southeastern Connecticut. So it looks very different where you go. In Southeastern Connecticut, the ethnic population makes a difference, right? So you have to look at your population in Bloomfield and say, who's our population and what are their needs and what does that look like here? And then you can actually start to refine those pieces a little bit more about what it would look like there.
All right. I'm going to go to the mayor with her hands up. Yep.
Thank you, Mr. Chair. And I think I was just going to say one of the things that Randy had talked about was an equity statement, and for us to come up with a shared understanding of what equity is. And I just wanted to bring that up because we've done so many different pieces of it, right? So ABC started the work. We had some courageous conversations. We talked about unconscious bias. We've had some of those conversations with our council. We've had some with our employees. We've had some with our community, right? So that's a work that needs to continue. We signed a proclamation for the health equity solutions with race being a determinant of health. We signed that proclamation. That's another prong. We're working with the Minority Construction Council to come up with verbiage to make sure that construction projects in the town of Bloomfield, their minority piece is strong and strengthened. So that's another piece of the equity pie. So there's so many pieces of the pie. I think we probably do need to go back to the beginning where we talk about definitions, we talk about a strategy for what Bloomfield will do with the work of equity and making sure that all these pieces come together in a very succinct way. So I think Randy just explained that, and that was my frame or my thought process as well. We have to make sure that equity is a priority. We also have to make sure that we get buy-in, right? Buy-in from our community, and that we also set what that framework looks like based on the buy-in, because we have all these pieces that we need to put together to really have something robust for our community, and then have the resources behind it to make sure that it's effective. You know, that toothless tiger, that our tiger has teeth and our tiger is ready to roar, I think is going to be the most important things, and not losing anything along the way, right? So whether we're going to start with health, and while we're working on health, we're going to start and make sure that this minority contractors piece is going steady and straight, and then we're going to look at all these other trainings, and whatever those priorities are, I think we need to come to a conclusion as to what that needs to look like. And there's things that we can do in tandem, but I think we need to get a good framework so that we can move forward and be impactful and productive.
Thank you. I just want to add, I think both Councilor Wong and the mayor touched on a lot of key points along as with Randy. I mean, the part that I was thinking about as we go through this when this came up, and I know 3 years ago we went down this path and started some of the work to the point where we're hearing from our stakeholders within the town. I think that's important. They're the ones that are dealing with some of the challenges that we may not be aware of. And I think that's important. But I think even more important is for the legislative body, the council, to have a sense what equity really means, and to not only understand what it means, to accept that we do have a problem. You cannot fix something if you don't think there's a problem. And I think that's important through this process. So Randy, the part that I really want to understand as far as a process, do communities go out and get a consultant to come in and, as you say, help drive some of those discussion, gathering that data per se? Because I look at this from, if we were to start this work, we have to be able to understand the various departments within town government on what's going on. What are some of the challenges and ability to improve certain areas? How do we go about in getting that information based on your
some communities do engage a consultant at various stages, but as I mentioned, in order for the work to be sustainable, there usually is a committee within the town council holding the work, right, who is interfacing with the consultant to some degree. So some people try to do it on their own, and I don't say that they cannot do that. Some people bring in a consultant to do it. It's all up to what you feel that you need. I think if for nothing else, someone helping you come in and at least develop your strategy that takes all these disparate pieces and say, how does this actually achieve the goals of equity in Bloomfield? Because often what happens with this work, people just start doing stuff without a clear destination in mind. What is our North Star? What is it that if we turned on equity tomorrow, what would that look like? And start there rather than just doing different things. And a consultant can help you go through a 2, 3, 4 hour conversation with a particular framework to at least get that. Then if a committee wants to hold the work ongoing, you can do that and engage a consultant as needed. Or some people keep a consultant, over time until they feel like they have a solid plan that can be moved forward within their particular town by a particular committee. So it really is analyzing where you are as a town on this journey and saying, what's our highest need right now? And do we need to have someone come in and help us get one solid direction that we're all going on together towards the same end?
Yeah, on a personal opinion, I see it being, I'll let Phil go after this, but I don't see us achieving that without having a consultant, because I don't believe we have that. We have anyone on staff that could be able to drive that workload per se. So I think that's very challenging. My thought process was to hire a consultant to come in and help drive some of those conversations through discussions and research. I don't see the council or any committee taking that initiative and having the knowledge base and ability to do something of value. And I believe that based on what you're saying, some of the communities that you've been in, I could see that being part of the problem. You have, 9 elected officials sitting down there and they all have variation of what they want, but there's no guidance, professional guidance per se. I mean, some of us may have that experience in that area, but not. So that's my opinion, but I see the deputy mayor has his hands up. I'll go ahead and give him opportunity to opine.
Thanks, Mr. Chair. This has been a good discussion. I really appreciate Ms. McCrae's commentary. I think it's give us a new focus. Obviously, I mean, I'm very much supportive. I would like to see this equity process move forward. I think we need it as a community, but more so we need it as a nation. And I think it's important that what you said about goals to measure. Unless we know what we're doing, unless we know where the disequity is, we don't know how to get to the equity. And I think that that's a process, very important process to go through. And I appreciate the comments made thus far. I was wondering whether or not the town's community awareness task force might be a suitable entity to manage this process. I recall when being on that body back in the 80s, we had a very difficult task that none of us really knew about. It was dealing with redlining and so forth. And it was a matter of that group flushing out all the different issues and options that we had to deal with and coming up with a policy for the town. And I think, if I recall, I don't know when they last met, but it seemed like they're a good cross section of the population, and they have all those kinds of interests at mind. So that may be one alternative. I'm not saying we have to use that, or maybe we want to set up another committee. But I agree with you, Mr. Chair. I don't think it should be any of this committee or any other committee of council. It would be good to have it bubble up from the community so we know what issues the town itself can address. It may be something we can address, but we have to come up with something that at least doesn't raise expectations beyond the ability to deliver something. And I think the more we discuss it, the more we could figure out what it is we can do. Thank you. Thank you for that.
Yeah.
Phil had his hand up.
Yeah, I'm trying to unmute him. 1 second. Yep, Phil, you're
I
on.
just unmuted myself, I think.
Yeah, you did.
I can't agree more that we need to go ahead and move to do something. I've seen on my own behalf significant differences of opinion, and I'll be honest with you, between different sides of town over different issues. And I think that I find myself battling on both sides at different times. I won't say battling, that's perhaps too aggressive, but at least fainting on either side in certain issues. And I think that there's a deeper need here to get everybody together on some of these particular issues. I can unequivocally state that there's nobody in the town staff that's capable of doing what Randy's doing. And I think if we want to proceed with this, we need to look seriously at hiring a consultant. The structure that we set up that the consultant works for is, of course, obviously, involving all of you as on council as to how you want to proceed. Again, we've got overhead issues with that. I do know that Windsor is in exactly the same process. They're a little ahead of us. They put out an RFP a couple months ago, and they're in the process of selecting a consultant right now to work with them. The cost estimates, when I talked with Peter Souza, he told me they were all over the place. He's got a range from 25,000 up to 110,000. And I don't know whether his RFP wasn't designed well before it went out, or whether there was misunderstanding of what was being looked for. But he's anticipating something, as I think I mentioned to all of you earlier today. I sent out an email that he's probably looking somewhere in the neighborhood of $45,000 to move that ahead. I think it's important enough for the community that needs to be given serious consideration as we go into the budgeting process as to how you want to proceed with that. I mean, that's going to be in competition with other priorities that different groups and individuals have come up with. But I think that you need to take a look at it. But I do think a consultant, in my opinion, is the way to go. We don't have somebody on staff that's capable of really doing a thorough job, somebody that's got experience in this area. This is a growing area, as Randy has said, throughout the country. and it's needed, and we need to go ahead and pursue it. So I think, and I do believe it's community centric, and I think that that's what we need to do, is to look at Bloomfield and how we want to approach these things. So anyway, I'm supportive. I think we need to give it serious consideration in terms of the budgeting process that's coming up, because you're going to have probably more projects and recommendations and whatnot competing for fewer dollars. So that's always an issue. But anyway, that's really my comments at this point, Mr. Chairman.
Okay, thank you. All right. 1 second. I think you're unmuted, Mayor. Where is it?
Thank you, Mr. Chair. So I just wanted to chime in on some things, and I'm sounding like a broken record that the council is going to have an opportunity to come up with some goals, and hopefully this equity project will be one of the goals that we as a council can agree upon and coalesce around, because it will be beneficial to our community. I also want to say that there's portions of this that can be handled by the health district, and I'm just talking about the health equity piece of it. I know that they're looking to do health assessments, so we can start doing some of that work, gathering some of the information that will help to guide some of this work. Also, to the Deputy Mayor's point, the Community Awareness Task Force, that's what they're tasked with. They're tasked with seeing the issues that divide us and seeing how we can work together to be one community. So there's some work that can be started that won't cost anything. There's some conversation that can be started that won't cost anything, that once we get a consultant on board, I'm not quite sure how long that process is going to take, but that we can really get some things moving. So that's my word of encouragement to my fellow counselors, that when we do start looking at our goals, that we can try to make sure that they're goals that will benefit our entire community. And as I think this work of equity will be one such goal. And in the meantime, there's things that we can start to look at and information that we can start to gather to make this work meaningful and impactful.
Yeah, thank you. Thank you, Mayor. And I just want to add, I think it's more important as we go through, as the town manager said, to really bring this up and take it seriously, because I believe, and this is just my opinion, I believe the first phase is the council have to decide, okay, we're going to invest, 40, 50, 100,000 in getting someone to come in here and to do the heavy lifting. I know we talk about the community task force, and we're talking about the health district, but I truly do believe that once you have that expert in place, that individual can give guidance, because you can have multiple individuals running off in different directions, but having that professional who knows what they're talking about, who knows what they're doing, to give directions, I think it goes a long way, and it moves it forward. So I truly do believe that we have to, I think before we even move forward, I think we have to make a decision as we go through the budget process, and it's something that I would support to fund this. It's something that needs to happen, and I think we grasp this opportunity right now. Look at it, our neighbor Windsor is already doing the work, so we're behind the 8 ball. So I truly do believe that we have to take this seriously as we go through the budget process. And I would say, in my opinion, the phase is to get the funding, to bring a consultant in to start the work. I think it'll be counterproductive having all these various pieces trying to pull stuff together and not having that guidance. Deputy Mayor?
Yes, thanks, Mr. Chair. Question, whoa, I lost it. You there? Am I there?
You're there.
I don't know what happened.
No, you're there. You're there.
Okay, well, I don't see you all, but let me just keep talking then. I'm just wondering, based on comments of the town manager, whether or not we can, at least in anticipation of the budget session, come up with some idea of what an RFP might look like that meets our needs, so that we don't lose time on that. That may be something we can move forward on.
Okay, thank you. Councilor Wong?
Thank you. Goals. I kind of like that word. I kind of don't. And here's why. I think that we've deprioritized as a nation racial equity and social justice for a very long time. And I would really implore my colleagues, all 9 of us, to make this equity policy a requirement for our town, not just one of our goals or strategic objectives, but a requirement to put some energy behind, to prioritize from a dollar standpoint, and to really push this in all of our committees that we sit on in everything that we do. I think that we need to, is it a Desmond Tutu tote? We got to stop just pulling people out of the river. We got to go upstream and we got to figure out why they're falling in. So I'm excited to work with everyone on this. I don't know what's the next step from a governance standpoint. I know, Phil, you're gonna put together, to Deputy Mayor's point, some next steps for us as far as, do we do an RFP? Do we, based off your knowledge of calling around a few towns and having those dollar amounts, do we plug that into the budget for top of spring? And who is the group that is going to help work with the consultant? I mean, I like Randy's suggestion as far as having a small subset of the council liaise and kind of phase in through the community, through the various committees that we sit on, and leverage the existing kind of operation structure that we have from a committee standpoint. I would definitely like to be a part of those, whatever it is. I don't sit on the community task force. I sit on council. So, you know, there are some things that we need to discuss as we move into budget season. And again, I just really encourage all of my colleagues to take this seriously and make this a requirement, and as well as a goal to have, but a requirement just makes it more definitive. It makes this real. It makes us serious about really enacting change as legislators for the town. Thank you, Mr. Chair.
You're welcome. Councilor Di Lorenzo?
Thank you, Mr. Chair. Yeah, I was just going to add that maybe what we should be doing then is sending this to the full council with that request for an RFP to go out, and have the full council approve that, attaching this policy to that request so that everybody can understand what it is, or possibly having Randy, if she's available, even come before the council and make some of the great points that she made tonight. You know, it doesn't seem like enacting this policy without having anything to back it up or anything in place to move it forward, because there's so many things in that policy right now, the way it's worded, that would make it incumbent upon the town and the town departments to take on a lot of that work. And I think, you know, given all the comments we've had tonight, I don't see how that we can do that. So my recommendation would that we go to the council with the request to issue an RFP. That's the only way we're going to know what the costs are. I mean, as Phil mentioned, you know, anywhere between 25 and 110K. But if we could get the RFP out and get the cost back, then we'll know more what we could put in our budget for a consultant. Yeah. So that would be my thought.
I'll go to Phil in one quick second. Councilor Di Lorenzo, I think, I don't think this policy that Councilor Wong proposed to the committee is in any means to move forward to get a vote.
Okay.
Council. Yeah. I think basically it's to start that discussion to say, we need a policy for Bloomfield.
Right.
So based on what Randy's saying, as we go through this process, we will help carve out a policy that will work for us based on the data and information that we receive within the town. So I think the sooner is better for us to start the work, to be able to start building on a policy for Bloomfield. So that's just the steps from that standpoint. So
right. No, I agree. And I think the policy could be the background for that, because there's a lot of good background information there from Council Wong. So that could be the setup for that.
But I do agree with you in regards to at least that phase in getting the council to vote on and taking the initiative to do an RFP or so to move forward. I think that's a good way to move this.
Okay.
See, there's some hands up. India, do we have some hands raised in? Okay.
Phil had his hand up.
Yep. Sorry, Phil. Yep. Phil,
Yeah,
go ahead.
I was just going to say that you're probably talking despite our desire to get things underway and going, I think you're talking about really, and I think Danielle outlined it in her program, is basically a 3-year look at getting all of this up and running. I think it's very important on any RFP that the scope of services, which is what we're asking for, be vetted by the council and making sure that that's exactly what we're looking for. I don't know about Windsor's. I mean, it's a good outline, and I think that we can pirate some of Danielle's policy draft into some of the scope of services. I'm more than willing to start working on that and getting that moving along. The other issue is that if you put it out on the street and you have it come back, we have a price that we can put in the budget, but the budget doesn't start till July 1st. So unless you want to somehow come up with other money in between time to move it along, which is very scarce, I might say, I think, you know, I'm kind of Dr. Doom on the budget side of things. So we have to be careful of where we go that way. But I can certainly put a draft RFP together. I think the council needs to decide perhaps initially which subcommittee, because this is going to be a multi-year process. I think the Community Awareness Task Force is a good sounding board. I think it's got a lot of input that it can give. I think it needs to be kind of rejuvenated. We get some people joining that. I think it was a pretty much of an open attendance to the meetings that I went to several years ago. We got some good discussion going, and so I think that's the type of group that you need to start, you know, feeding the RFP back to make sure that we're looking at some of these, even though they may not have the entire expertise. We can get some ideas that way. And then I think we need to have the consultant kind of really blueprint where we go from there. So once we get the consultant on board, then we can start to really get a plan going and with some scheduling and whatnot. The whole data collection thing is somewhat of a concern to me, because we've had real problems staff-wise, even getting data together and measuring it and so forth. So I'm looking at would want a software program, Randy. I don't know if there's some out there that are looking at this that have already been developed. I think the whole DEI, as I framed it, initiative, is far enough along that there's got to be smaller communities out there of Bloomfield size and diversity that are already working on these issues and so forth. So I guess what I'm saying is there needs to be some collateral input information from different communities, maybe even nationally. I think New England even more so because of some of our peculiar governmental stuff and processes and that sort of thing. But in any case, it'll be a major effort, and I think the consultant obviously is going to have to map out where we go and how we gather things, and then the evaluation part of it, which is so important as to whether you're having an impact. So that needs to be developed. How are you going to evaluate? You know, so anyway, I'm going on and on here, but I think I can go ahead and start putting a draft RFP together. But the council's work has got to be looking at it from the resourcing standpoint of budgeting, and then how are we going to develop the more definitive scope of services if we're going out, and how you organizationally want to move it forward. Do you want to have one of the subcommittees of the council manage that process and we work on it, similar to a certain degree as the public arts policy? You know, we can go ahead and work with a subcommittee. That way there's some council tie-in already. We're not educating people on why we're even doing this in some cases. So anyway, just some thoughts, and we can continue to discuss as we go forward.
Randy, you want to respond to anything that the town manager
Yes,
just?
I was just, well, I was thinking of just listening to all of this overall and saying, you know, my professional suggestion would be there is some pre-work to even bringing this to the full council in terms of that broader equity strategy that encompasses all these things. So I think that even though you've had some training and you have some shared language, I think what would have more teeth to it is presenting a full equity strategy to the council, and that there's an opportunity to have that conversation with the Alliance for Bloomfield's Children, because they had invested in a particular framework that can help guide that conversation. So I'm just offering that as a suggestion to think about before launching this forward so that it's more refined. Because as the town manager mentioned, you got to put RFP out that might be coming to consideration until July. So what this time could be used for is looking at that framework from ABC, doing that pre-work, so that way when you have that RFP ready to go in July, you have something more tangible to ask the consultants to do. So it kind of just gives you an overall guide about how you would go through this type of pathway from where you are right now, which is, I think of this work in phases. And from all of the feedback that I'm hearing from everyone, it sounds like it's like you're moving fast into implementation, but there's some kind of stuff that we normally do in this work that I think might be helpful before even bringing that to like a policy level. So, you know, that's just my, you know, my analysis based on what you all have been sharing and what, you know, I've sat with some of you and we've done some workshops and conversations together. And it is a framework that the Alliance for Bluefield's Children invested in that could be helpful as a precursor to all of this other stuff. So that would be something I would suggest could be a potential.
Yeah, I just want to add, and I think this is something, I don't know if the mayor is working on this, but I think what would be important for us to, as a council, as a body, to reconvene and talk about some of the things that you just outlined, as far as some of that work, what we're trying to accomplish and what the mission is. Because if we don't have a focus on what we're trying to do, I think then it's very difficult to ask anyone else to do it. So I think that would be a recommendation for me, for us to really get into a room, sit down, and kind of hash this up, come up with something to be able to present not only to the community, but at least start the conversation. Councilor Wong?
Yes, thank you. In response to some of the things Councilor Di Lorenzo said, as well as Phil, in regards to kind of moving this forward in the governance process and what that looks like, I'm not sure, I'm pretty sure most folks have seen the 2-page or 2.5-page framework of a policy, and the current policy has language defined in the policy that basically says, okay, you now have to go create these programs. So to Randy's point, the policy in this form would require us to seek out these consultants and seek out an equity strategy and further develop. It doesn't mean passing this particular language suggests that we have everything together. It just makes it real. It just makes the equity policy real. It makes it a priority within the town. And I want everyone to kind of look at it that way. There's very general language there. It does define what equity means, and we're gonna work on that, right? We're gonna unpack that as we move forward as a council and these subgroups. But I guess me, from being a process person, I would even go as far as moving this forward to council and passing this interim draft policy contingent upon identifying dollar amounts and starting to dive into the strategy of the equity strategy and other reporting and other disparate studies that we need to execute. So this isn't to say we have it all together by getting this on the books and passing this as a council. It just mandates us to continue the work so it doesn't fall off the grid. It doesn't kind of fall off the back burner if we shuffle around from a council perspective. Whoever comes next after us will make sure that this is on the docket and these continue to move. So that would be ultimately my recommendation, to essentially bring this in an interim draft form. So we continue to work on this and we continue to assign dollar amounts to continue to be approved upon during our process. So that would be my 2 cents. Thank you.
Diana?
Thank you, Mr. Chair. Just probably going back to Randy and just some of the things that she was saying, and she could probably just jump into where I am not speaking clearly. But I think it's important for us to say to our community that we as a council is mandating, committing to equity, to the equity work in Bloomfield, and that we are putting a priority on that. I think that's one thing, and I think that's a great thing to do. My concern is with the policy and not having gone through some of the steps that Randy has identified tonight. So I think there's a way that we can say that this is a priority for us and we're committed to this and this will happen here in Bloomfield, without us saying that this is the policy, because I believe that, once again, based on what she has said, we haven't gone through some of the process. And Randy, if you're still there, can you just chime in for me?
Yeah, so I think it would be worth taking the policy that as you have it and identifying what pieces of data respective to Bloomfield is driving the policy as a policy justification, and then bringing it. And so at the very least, taking this document and having a conversation around that document where the goal is to make this the policy, but then say, here is the justification for it. This is what's happening in Bloomfield. Where we gather that data from, there's probably a couple of places to get that from. Connecticut Voices collects data. Many other entities collect data. I think adding some of that to it would make it more customized to Bloomfield. So it doesn't feel like this was ported from somewhere else to this, that people can read that and look at that and see Bloomfield in it. I'm not saying that hasn't been done. I did look at the draft of it, but I think that would be closer to a refined piece to bring to the full body, because what it would have in it, because people are going to look back to that and check in on what you've done to see if this is meeting their needs of what needs to be done. So the closer that this document can be to that out the gate, presented in its form, would be beneficial and would be something I would recommend. You don't have to do it that way, but that to your point, Suzette, about it having, teeth on it, right? To one point, and someone has mentioned before intentional, right? So if you're intentional and it has teeth on it, it's very customized to your specific community. And so that's that added piece it would have, that people can feel it. You don't want people to read it and just read words. That seems like rhetoric, that we're saying it just to say it. That you can actually feel yourself in it, and you can look around Bloomfield and say, yep, we need this because of that, and that. And so people are checking back in on that as you move through the process.
And I just wanted to add, I don't know if anyone went to the CCM conferences last week, but I was able to go to some of the sessions last week, and they did have a very robust session on equity and what it looks like for Connecticut. And the Equity Atlas has a lot of information that would be helpful in us putting a policy together. Also, Health Equity Solutions has Bloomfield-centric information that would help us to put a policy together for ourselves. So I don't want us to lose the importance of it. I don't want us to lose our commitment to this equity work. I don't want us to lose the now, that we're telling people that this has to be done here in Bloomfield now. I just want to make sure that we're doing it with the right steps, and that we're doing it in the right order, and that it's going to be purposeful and intentional for us. So that's just my 2 cents. I'm going to go with whatever the majority of the committee says, but that's just something that I was thinking about.
Phil, do you have something to say? 1 second, Councilor Ron.
Yeah, and I think, can you hear me? I guess so.
Yep.
Yeah, I would tend to agree with the mayor and with Randy to a certain extent, and I guess Danielle. But we're not even at the starting gate yet, and I don't want to be. I know I brought up the issue of data, but that was like in the 3rd year of Danielle's program. We're not even. I mean, I went to some of Randy's, I think 1 or 2 of them. I was reminded that I went to 1 or 2 of them, and I feel I need to be re-educated again as to what exactly went on. So that's how far back I am in terms of trying to develop a coherent policy to move forward. So I'm a little bit leery of some of the language in Danielle's draft where we're mandating department heads doing this when they don't even have the skill set to be able to do it. And so what I want to do is to back up, let's get a consultant in, map out a plan, resource the plan, and we can do that relatively rapidly, other than we have budget issues for the next 6 months here. So unless the council wants to try to overcome those budget issues within the 6 months, depending upon what we get back. I mean, the RFP process alone will probably take you 6 weeks to 2 months. And then you've got to have somebody looking at this as we go forward to make sure it's what we want. And that's why I'm up for getting a consultant in to work with us on this, somebody who knows the field, because I don't know the field that well. I'm learning myself. And besides that, another whole issue is that I may not even be around when you get into the implementation stages of this. So you got to look at that, part of it too. You don't want somebody charging ahead who's not going to be here, maybe, anyway. I don't want to prolong the discussion on some of these issues, but I think we need to take one step back. These are good ideas. I can put a draft RFP together, but we really got to look at the scope of services on that. And we got to think about how this is going to be administered and so forth. But to get to the core issues here, we need somebody that's familiar with the field, knows the process, has been through the process in other communities. And the outcome may be Bloomfield centric. The process is pretty generic in terms of that profession and how they go about it. If you just listen to Randy and how she's articulating the steps that we need to take. So anyway, I'll be quiet from here on out.
No, that's pretty good, Phil. Can I make a recommendation? What I would say, because I do agree with what everyone is saying, I do agree with Danielle, with what Randy's saying. What if we look at it in this phase? We have the document that we currently have that Danielle submitted to the committee. We hired Randy to come in to do a couple sessions with the council surrounding that to get a document to tighten it up so we can then get something out to say, okay, here is the framework that we're going to work around. To me, that seems like a plausible way to go, where we can take that document, we can kind of frame it the way we want to for Bloomfield, and we can get something out there to our community to say, okay, here is what we're working on. I think that's a win-win for everyone. And we get something out there. It's an initiative. We're making a statement, and it's a framework. We have a consultant that can come in to just do that work, that part of it, getting that message out in the form of that initial policy that will eventually be built on as we move forward. Yeah, Danielle?
Thank you, Mr. Chair. I am very aggressive when it comes to social equity and equity, and it took a few months to get this discussion to this point here, right? So I'm excited that Phil had said we can do this fairly quickly. That's great. We as policymakers, politicians, and elected officials, we have to be able to prioritize things and be okay with pushing our agendas through. And while I understand, to Phil's point, and administration does have mechanisms in order to protect their operations, and he may say in the form of slow down, let's take a step back. Or I'm like, we're here, we got it. We know there's oppressive language in our policies. We know we've had implicit bias training. We know equity exists. Conversations have been conversations, and we have more, and we're always going to have these conversations. Now it's time to enact some real change. It's time to put it on the books to say, this is serious stuff. Yes, we understand that we're in very early stages and we need to develop these plans, but take a look at the document, the framework that I had put forth to council. It's a starting point. We're going to chop it up. We're going to piecemeal it. We're going to make it better for Bloomfield. But I do appreciate and I do agree with the chair's comments as far as let's chop it up in this phase. Like, let's make it real with a vote on council that, hey, we're serious about this. This is an initiative. We have a lot to go, a long ways to go. We have a lot of things to develop, but equity today is going to be a requirement from this council to continue to work on. And we are ruled by Robert's Rule of Order. We are not ruled by consensus building. So I kind of have to decry a little bit of that as far as, we're all saying verbally that we're going to continue to do this, but we have to make it real in the process. And we have to get serious about being legislators and policymakers, because that's our role. So I appreciate Phil kind of, making sure that he protects his office and his resources. I respect that fully. And as counselors and politicians and policymakers, we got to be able to take some big strides here and not continue to put racial equity and social justice on the back burner. So I just wanted to emphasize that a little quicker or a little bit more. Thank you, Mr. Chair.
Phil?
Yes, if you want to proceed that quickly ahead, and if we want to retain somebody, Randy or whoever, I need money. And so I would take it out of the council's contingency account. If you're generally in agreement with that, we can discuss this Monday night if you want. But I haven't even talked with Randy. I haven't talked with any other consultant. She may be too busy. She may be, because she's done work in Bloomfield, willing to do some pro bono review of a draft RFP or something of this nature. I don't know. It may be somebody else that we want to look at longer term. But I'm focusing in. You don't want a tax increase this year. Nobody does. We got budget priorities coming up, so I'm looking for some money here if we want to move ahead that quickly.
I want to give Randy an opportunity to respond, and I want to wrap up this discussion, but I really want us to, it's an important discussion. That's the reason why I'm letting it go, and we're having a discussion. We need to have this, but we need to wrap it up. And I want to hear from Randy. I'm going to go quickly back to Councilor Wong, and I'm just going to make a comment in regards to how we can move forward. Randy?
So there's two things. I hear Councilor Wong saying that her intention is to sort of get a policy in place that legislates that there will be intentionality on implementing equity in Bloomfield. So that's what I hear at the heart of what she's presenting. And that how you do it is something to be worked out later. I understand that and appreciate that and understand the intention behind it. So, and I know that you operate on Robert's Rules of Order, but as a facilitator, we do community building and partnerships, and we hope to get everyone on the same page and meet somewhere in the middle. So that said, to your town manager's point about the pro bono work, what I can offer, like I said, is through the work of the Alliance for Bloomfield's Children, taking that framework, taking Danielle's document, and saying, what we're trying to do is create a policy that mandates that equity is a priority in Bloomfield, and make sure that's what that document reflects. Can't say it doesn't right now, but that's something that we could engage with through the work of the Alliance for Bloomfield's Children, through a partnership that wouldn't be of cost to you all. So that's something that we could do that kind of meets what everyone is offering right now. It's just making sure in that document, there is a piece that says, this is the intention of the document. And then these are the steps that would follow us. So this document is intended to prioritize equity in the town of Bloomfield. And these are the areas that we will look at. Here's some of our community partners. Here's some work that's been done. I would add that to what Danielle has already presented and then bring that to the town council. We can do that through our partnership with the Alliance for Bloomfield's Children. And I think that that kind of addresses everything that you've all shared here. I don't know how that all sounds to you, but that is what I'm hearing with my facilitator ears.
No, that sounds great, Randy. I think you're spot on. I think that will at least get, that will suffice everything that everyone is saying to get something to say, okay, here's the intent of the council, and to start that discussion. So I do agree with that. What I would suggest as we wrap up this discussion is for both you and town manager to get into a discussion how we move forward with that type of initiative that you talked about through ABC per se, and getting us something that we could move forward with. Danielle, I'll give you a chance. Just a quick comment as we wrap up this. Yep.
Last one. Thank you, Mr. Chair. So, I just wanted to clarify, I am not advocating that we spend money today. That I just want to be clear, that's not what my intention is. My intention is exactly what Randy articulated, is to make this real from a council, a governance standpoint, from an intention standpoint. And I know our parliamentarian isn't on the call today, but I don't know what form we do that in. Is it a draft interim policy? Is it a resolution? What do we need? What can we get done Monday? Right. So that was my 2 cents there.
Typically, I'm not your parliamentarian. Sorry, tongue-tied. Typically, it is a resolution. So that's what other towns started with. It's more of a resolution than a particular policy, because the resolution is a statement indicating your intention to embark on a journey that would lead to particular policy changes in various areas throughout the town. So it really is just a resolution.
Correct.
Okay, thank you, Randy.
Yep.
Thank you, Mr. Chair.
Okay.
Don't we already have do we have a resolution? I thought we did of some, before I came back. I thought you had
I don't
maybe
know.
not. I don't know.
I don't know, Phil. You could look into it if that's the case, but I don't believe we do. All right. So thank you very much, Randy. What I would say is, Phil, I will send you Randy information. You guys could, in the next couple of days or so, get in contact with each other and start that discussion in regards to what Randy stated with ABC and trying to funnel it through that. And I think we can move forward from that standpoint.
Okay, sounds good.
Yeah. All right. Thank you, Randy.
Thank you.
Okay.
And I look forward to seeing and talking to you all when this pandemic is over.
Likewise. Stay safe.
You too.
Okay. So next item under new business. It's now 5:58. Let's see if we can finish by 9:15. Just kidding. Discussion and possible action regarding establishing Juneteenth as a town holiday. Mayor DeBeetham Brown.
So I'm going to be very quick because goodness knows I thought we would have been done already.
No?
So Juneteenth is currently recognized by 47 states and the District of Columbia as a state holiday or observance. I know that our governor declared it as a observance this year, I believe, but it's not a holiday for the state of Connecticut. It's not a holiday. The only town that I know that has made Juneteenth a holiday is Manchester, and that just passed. I know that the town has a list of holidays that they observe each year. I also know that there's a cost for that day. So what I wanted to do is just to bring up the conversation and have through you, Mr. Chair, have our town manager do some research on how it would go for Bloomfield, how much it would cost us. I know that we have bargaining units that have a list of holidays that they go through. So there's a lot of things that we have to think about. I do know that there's floating holidays. Some towns celebrate Columbus Day, while some towns celebrate Labor Day, while some towns gives you the day after Thanksgiving off. So there's some moving parts that's a part of our holiday schedule. So I'm going to ask through you, Mr. Chair, if our town manager can just look at it and gather some information for us. I don't know if everyone knows the history of Juneteenth. Long celebrated by African Americans, Juneteenth marks the date in 1865 when U.S. soldiers came to Galveston, Texas, to announce and enforce the end of slavery. That's what Juneteenth is. Some communities have events that they just observe the day, and some communities is trying to make it a holiday. So once again, with everything that I just said, if we can have the town manager do some research for us and get back to us, and then we as a council can make a decision as to what we would like to celebrate here in Bloomfield, that would be great. Thank you very much, Mr. Chair, and it's just 9 o'clock.
Thank you. Here's a question I have in regards to making it a town holiday. And would we have to collaborate? I know there's other issues within union negotiations, and there's a lot of things there. But what about the school system? Because if we're going to make it a town holiday, how does that affect parents who, you know, their children in school, or if they have to work outside of the town of Bloomfield, their children are still home alone, younger kids. And so how is other towns, you said Windsor?
Manchester
Sorry.
just passed it.
Is this,
And
yeah, did they,
so,
yeah.
once again, that's why I'm saying that, asking the town manager to do some research. I can definitely get you the information from Manchester. One of the counselors in Manchester and I have been talking, and she has great information about how they did that. So that can be provided to the town manager and to this committee for a longer discussion. I think for us, we would have to see what worked for us, right?
Yeah, no, I support it. It's just, I just want to know how it will work out with, you know, our parents and the school system. It seems like there will be some sort of collaboration. So if you could reach out to your contact and Phil do some research, I think that will be helpful to get something in front of the council. Yeah, Deputy Mayor. Yeah, thank you.
Yes, I fully agree with what the mayor's approach was. I think the holiday is worth consideration, but I think as she is right, to direct this to the town manager to see what the cost and operational consequences are, which include the comments that you made, Mr. Chair, because that's part of our administrative family over at the Board of Education. So that we get back this information, we can make some judgment as to how far we want to go with it. I think that's where to go. Thank you.
Yeah, thank you.
I just want to say one thing, depending on the date in June, and I don't know exactly what date Juneteenth will be celebrated in 2021 or 2022. It's in June, so it's quite possible that school might be out of session. So just to put it out there, we have to look into it though.
Yeah, I think the state, I don't know if the state, I thought I saw something that the state is also looking to make it a holiday. Yeah.
They observed it this year. The governor did make it a Governor Lamont officially declared the day as Juneteenth Day in Connecticut. Correct. He did state, but simply recognizing a day and educating people about our country's history is not enough. We must do more. We must take action to reach the goal of more equal and just society. So he has recognized the day. We have not yet gone as far as making it a holiday.
Yeah, that's something that we can definitely bring up tomorrow with the legislative discussion that we're having tomorrow through Bloomfield. What is it? The chamber. Yeah, Bloomfield chambers.
The hour of power.
Hour of power. Danielle, your hands is up. Is that your?
Yeah, just a quick question in regards to holidays and creation. I remember early on, earlier this year, I requested that we look into updating Columbus Day to Indigenous People Day, and I believe I was shut down. So I'm not sure, Phil, if that is within, like, I don't know the compliance and the red tape around that, but can we do this as a council? Because I remember hearing no.
The town, for the employees and for the town, we don't provide Columbus Day as a holiday. But if you want to make similar to what Suzette was just saying about a proclamation, or something that the town council recognizes October 12th as Indigenous Peoples' Day or something, that would be fine. You could do that. If, unless you want to make that a holiday too. It's not a holiday for the town. I mean, the bargaining units, to be honest with you, are going to jump on this and say, sure, no problem. I've got 3 or 4 other days that you might want to consider too. But, and I think we have to keep that into consideration because we're in the middle of potentially mediation and arbitration with some of our bargaining units. So in any case, I'll look into obviously Juneteenth and see what authority, powers, and implementation issues there are with creating a town holiday per se. And we can always look at October 12th or the, what is it, the third Monday of, or second Monday of October. So
Daniel,
that's fine.
to your point, the schools have changed it from Columbus Day, at least the schools in Bloomfield have changed it from Columbus Day to Indigenous Peoples' Day. Just to get that out there.
Yep. No, good discussions. So we could definitely get that going. So up next, Phil, I know you've been doing a lot of talking, but you're still on the agenda, town manager report.
Okay, I have a number of items just to bring you up to date. We will be having our S&P rating review for our January bond sale in the next week or so. So that's a major effort by staff to gather all of the data. S&P usually provides us with a list of questions ahead of time, usually a couple of pages of questions, everything from, you know, tax collection rates to development issues and staffing issues and anything that affects financial management there and the potential for a credit rating they're asking about. The town manager requests for proposals, essentially, those are due in on the 10th of December, later this week, and we'll have those gathered by then at the end of the near the end of the week here. I do want to suggest that at some point the council is going to have to decide how you want to proceed in the selection of a firm. We can provide you with the results that we get in. I think the last time you formed a subcommittee, and that subcommittee worked with Sharon in our office to go ahead and select a consultant that you were comfortable with to move that process along. So you need to be thinking about how you want to proceed with that. I've got initial interviews with 3 candidates for Director of Finance this week. Hopefully we'll be able to move that process along and have a resolution to it at some point. Saturday's storm cost us about $13,442.37. We've broken that down in wages, material, meals, and fuel. So we do have storm reports after each major storm that we put in. We've talked about 7 Victor Street. The operational manual for the operational budget went out today to department heads. The operational budgets, as opposed to the capital budgets, the operational budgets are due back in on December 8th, or excuse me, January 8th, not December 8th, January 8th. So we'll be starting to get into the budget in quite a bit of depth here shortly. We've gone ahead and I've authorized to have the EV, the electrical vehicle charging stations, which have been for free up to this point. We're going to be instituting a charge. We've got a number of people, I won't say a number, I think 2 or 3 that continually use them every day, all the time. It costs the town about $7,000 a year to provide free electricity to these charging stations. And so effective probably in the beginning of January, we'll be charging for use of the EV charging stations. And we'll be putting out a policy, probably a notice under windshield wipers for those that are using it, but I want to let you know that we're moving ahead with that. Lastly, on COVID, we've tightened up, continued to tighten up over the past several weeks, town hall procedures, library, public works, human services center, access, and so forth. If you come to the town hall, you have to be escorted to an office now. We have the standard mask washing, personal distance, 6 feet requirements. So we have tightened up. We're not under lockdown, and in all cases we haven't gone to complete rotational schedules. In some places we have gone to rotational schedules at the Human Services Center, where we get a lot of traffic, people walking in and out. We do have rotational schedules, and we'll be probably starting rotational schedules with one person out of each town hall office. But the rotational schedules will be in the building. These people will be in the conference room or different conference rooms, operating independently from their offices, but they'll still be under supervision in the town hall on a daily basis. We're doing this so that we can continue operations. I'm sure most of you know our departments and divisions are very small, usually 2, 3, maybe 4 people at the most. And if we have one person that tests positive, everybody, if they're around, goes on quarantine, and we have to shut the office down almost. So we're taking precautions more than anything else at the moment concerning the COVID situation. We are working with, as Amy indicated, with the testing programs. We've been using the town green. We've been trying to set up a drive-by testing station. We do have the Board of Ed cooperating with that on Wednesdays. We have not had the first attempt yet, so probably coming up in the next several weeks. We hope to have a drive-by testing process going on probably at the high school, at least for a while, and try it out. So that completes my report.
All right, thank you, Phil. I just have a quick question. I'm a little concerned with the S&P review. And, we heard tonight from Jose Geiner with staffing issues there. I'm happy to know that we're going through the process right now in trying to hire, someone in director of finance. That's clearly a position that review would look at if we don't have in place as a major deficit to the organization per se. So
I think you got to realize that the turnover that's occurred, not so much in Jose's office, because those are people that are not directly involved with the financial management of the community.
Right.
But the turnover in the town manager's position, the turnover in the finance director's position are sure to probably be questions that we've got to look at. I will say this: we have skull sessions ahead of time with Barry Bernabe, who was there during the phone call when it comes in. Usually these phone calls, we're not getting a Moody's rating, we're just getting an S&P rating. S&P usually operates out of Boston, so they're a little bit more New England centric in terms of our operations and on a comparative basis. Moody's generally operates out of their New York office. They generally have an experienced analyst handling the call, and then they usually have an intern or a new hire that's there with the analyst to kind of learn the analyst trade a little bit. So I'm confident we can handle it. We've done it in the past. I just wanted to alert you that it was going on. So I think we have the questions ahead of time. We get with the department heads, we bring up the data as much as we can and look at it, and we're in good shape. I'm not worried too much about it at all. So,
are there any other questions for Phil from the committee? No. So Any public comments, India? Do you?
Yes, there is. Mr. Larry Pleasant, his question is, given the S&P review that is coming up, do you see any areas where we may need to improve?
There's always room for improvement, and they're always looking, the rating agencies are always gauging things. I think the areas that they're currently more focused on include OPEB. Are you making your annual required contributions, your ARC? The same thing with any defined benefit pension plans, of making sure you've made your ARC payments. How's the audit coming? You know, where do we stand with that? There's a bunch of these things. Tax collection rates, and as most of you know from our monthly financial reports, our collection rates are fine at this point. We don't have the second payments obviously in. That won't happen until January. They look at growth in the grand list. What type of development do you have going on? And we've got a number of different projects that we can point to that will add to the grand list, some with abatements, some without abatements. So I think we're in fine aspect. Obviously, there are going to be questions about COVID, and that gets more back into tax collection, delinquencies, all of those sorts of things. Bloomfield is well situated, and I'm not concerned with that at all. I'm a little bit more concerned about the questions about the turnover in senior staff, and I think we can handle those without too much of an issue. There are reasons for those, and if they probe deeply and want those, I'm more than prepared to provide them in a Bloomfield positive centric manner. So we'll
it seems like a lot of
deal with them
tonight
as they come along. So, but I think Larry, if you're there and listening, or whoever, I think it was Larry.
Larry, yeah, but he's listening to you.
Yeah, he's, you know, I'm more than happy to talk with him individually or otherwise, but I think we're in good shape. I'm not too worried about it.
All right, Phil. I know Linda has a question. Linda?
Thanks. Yeah, just quickly, on the public art policy, when you were discussing it, I was searching the site, the town website. I can't find a copy of it. I thought maybe it had been attached to agendas of either the town council or this committee, but I couldn't find it. So is there a way, maybe somebody knows where it is?
India?
The policy, hold on.
Yeah, didn't that go out with the?
It went out with my copy of the agenda.
Yes.
Well, it's not on the copy that's under minutes and agendas. You know, that's on the website, or from the link that you send out went to the email list for, you know, citizens, and you click on the link and you go to the agenda.
I can upload it. I can upload it for you, Linda, or send it to you directly.
Great. Thank you so much.
You're welcome.
Appreciate it. Thanks, everyone.
Thank you, Linda. Okay, next, approval of minutes.
Yeah, so the approval of minutes, there was a misspelling in Mr. Ferger's name, so I just corrected that.
Yeah. You had a question, Deputy Mayor?
No, move adoption or acceptance.
So we have a motion, we have a second. All in favor signify by saying aye. Aye, yep, motion carries. Do you have a motion to adjourn?
So moved.
Yeah.
Second.
Meeting adjourned. Thank you, everyone, for your patience tonight. I think it was a very important
It was
discussion.
good.
And
Good night,
thank you
Sharon.
all.
I don't know, Rick, for your meetings, it's starting to turn to town council meetings. I don't know.
A lot of discussions on, you know, healthy discussions. We need to have
Yes,
it.
sir. Yes.
So anyway, have a good night, everyone.
Thank you. Good night.
Good night.